My name is Nicholas Rure, an anatomist and a radiologist. Yeah. We'll be talking about the radiographic anatomy of the thorax or chest. And we are going to start from the basics. Before we talk about this, you will have been aware, that you are vast with gross anatomy of that region and with very good knowledge of that. So with that, we'll now move on to the chest radiograph. And before we start off, the chest radiograph has two positions, and the major one we do is two major views, AP and PA. But most of the one that we do is PA. Occasionally, AP is being done. Other views that can be done are oblique views, especially when you're thinking of fracture of the ribs, and lateral view. Chest X-ray is the most widely radiological investigation that is being requested for worldwide. So there's hardly any time that you will not find a test on chest radiograph. Also, chest made simple. We're just going to go to the basics. The thorax is made up of, the framework is that of the bones. Part of it is the spine of the thoracic vertebrae. Furthermore, because the lungs have air, so we are seeing this as lucency or radiolucent areas, okay? And there's a central lucency that goes vertically down, which is the trachea. That's how the trachea appears. And it gets further and it bifurcates to the right main bronchus and the left main bronchus. While the right main bronchus is short and is wider and vertical, the left main bronchus is more horizontal and longer and narrower compared to the right. However, the bifurcation takes place at the carina. So going further, the thorax itself has a cavity with some structures or organs within there. But the main organ of the thoracic cavity is the heart. And this opacity, the opaque area, represents the cardiac shadow. Okay. And on the cardiac shadow, you have the left border of the heart, which is made up of the left ventricle and the left atrial appendage, which it's a little bit difficult to see here. While the right side of the heart is made up of the right atrium. However, the size of a heart is usually less than 50% of the size of the thoracic diameter. That is to say, the cardiothoracic ratio is usually 50% or less. If it's more than that, if the heart, then it becomes what is called cardiomegaly. I hope we remember that the heart pumps blood to the rest of the body. And what that means is that it will walk through the great vessels. And here we can appreciate the ascending aorta. It goes on to curve to the aortic knob or arc of the aorta. And below that you can see the cursor, is the descending aorta, which is in the thoracic region. So, furthermore, you have between the heart, cardiac border, and the hemidiaphragm, there is an angle called cardiophrenic angle. And between the hemidiaphragm on the right side and the rib, you have costophrenic angle. Similar thing is seen on the left. However, in the course of doing this, we need to know that what we are seeing here are the hilar regions, right hilum, left hilum. And usually the left hilum is higher than the right hilum. Similarly, in the inferior part of the thoracic region is the diaphragm, and the right diaphragm is usually higher than the left diaphragm, the left hemidiaphragm, and it is not unexpected because the liver is on the right side of the abdomen, which pushes the left dome of the diaphragm. Left pushes the right dome of the right diaphragm. The lucency here tells you that there's gas, and this is usually called the gastric bubble. It is usually on the left. Okay. Furthermore, there are other bones that I didn't mention earlier when I was talking about the bones of the thorax. We can see, what we can see here, we have the medial border of the scapula, bilateral. When you are doing when you are doing a PA, there's a way you position yourself so that it throws off the scapula. Otherwise, the scapula will have been supine. I mean, other structures will have been superimposing on the scapula if it's on AP or supine. So with this, I think it will not be much of a difficulty for you to know the anatomy of the chest. Thank you.